Hi guys, I am setting up here to be able to talk about hormones today, which is specifically HRT. I'm gonna go live here and TikTok, and hopefully that will be useful for all of us. Idea is to create a video where we can talk about hormone replacement therapy and commonly asked questions. So I'm going live on TikTok and I'll be taking questions from TikTok, and then I'll have this video up here on YouTube for those who wanted to potentially watch that in future, because I had those requests as well. So for those who are not familiar on YouTube, my name is Dr. Angelina Pastoev. I'm a board certified surgeon, triple board certified, and we are starting to discuss other topics other than the usual surgical topics or weight loss topics. So today I wanted to kind of focus more on hormones. And basically, I was going through a Q&A about bioidentical hormones, what it is, why things the way that they are. And at some point, actually, I'm going to take this little booklet. This is from Dr. Neil Razier. He's one of the people that everybody goes to learn about hormones. And I'm probably going to make another YouTube video where I'm going to actually I'm going to read the book for you guys, because technically I want everybody to be well educated before I start on hormones. Hi, you guys. If you're new, you can click the follow button and the like button, and that will help. And on YouTube, click the follow button and subscribe button. So hello. So as I said, I was talking about hormones today. So hormone replacement, estrogen, progesterone, frequently asked questions. Number one, what are the hormones and why do I need them? Hi, Yolanda. Changing topics today. And so hormones are essential parts of our metabolic processes for us to survive. We need our hormones. Hormones are important for the cells, organs, and metabolism. Our hormones decline through time. Did you know that? Did you know as we get older, things get older? And of course, things like menopause, trauma, surgery can decrease your hormones as well. Obviously, aging is a big part of it. When this happens, we begin an accelerated aging process. Loss of hormones is one of the major reasons for our deterioration as we get older, both physically and mentally. Hormones are beneficial at any age, but the best long-term protective benefits are achieved if hormones are replaced when you begin to lose them, which is usually in our 40s. So this is like a big thing, because people are like, when do I start hormones? When is the time to start looking into it? And first we're running around thinking we're still 20 years old until you cannot get out of bed anymore, and you're like, oh crap, everything hurts. And then you realize you're not 20 anymore, and that's when you really start thinking about the hormones, or should be thinking about hormone replacement. And some people it's earlier than 40. Some women go in early menopause, like mid-30s, and then you really need to do that. Thank you for the likes. Okay, what are the typical hormones that are prescribed? So there are a couple of different formulations, and we're going to get into it as well at future podcasts and talks. But Doc, we are 20. Well, up here, yes, 25 forever. So there are synthetic and bioidentical hormones. The synthetic ones, synthetic estrogen, is Premarin, and then progesterone, different progesterones. Provera is the synthetic progesterone. Those are produced in laboratory. So they're chemically altered to become different than the original. Remember, pharmaceutical companies cannot patent the original. We make it. You can't patent something that exists in nature. So they synthetically engineer a hormone that's supposed to look like our regular hormone, but it's not. They are not identical. So those synthetic ones are not identical to human hormone. They're designed to try to elicit the same responses in your body as your natural hormones, but they're not. Because synthetic hormones are not identical to human hormones, They might adversely stimulate the cells and lead to side effects or cancer. That's synthetic hormones. Premarin is an estrogen obtained from pregnant horses and not human identical. They actually get it from, I believe, horse urine. Both have been implicated in causing problems in some women, including breast cancer. So when you hear this narrative that, oh, estrogen causes cancer, progesterone hormones cause cancer, we're talking, or they talking about synthetic hormones. And that's different from what we're talking about. Why can't we just donate our estrogen? Because we'll start to lose it as we get older. How are bioidentical hormones, estrogen and progesterone, produced? Hormones that are identical to human hormones are found in yams and soy. We call these natural because they are natural to the body. The hormones are extracted from these vegetables and then processed by specialty compounding pharmacies into prescription dose and form. The body accepts and metabolizes these hormones as if we made them. So when we're talking bioidentical, they are not produced from other animals. Hope that makes sense. What are the problems with synthetic hormone? And it's going to be a little repetitive, which I'm sure you guys appreciate anyway. When first developed, synthetic hormones were well received because they provided some of the benefits that, our hormones that we're trying to replace. Controlling the symptoms of menopause, fighting osteoporosis and heart disease. However, the long-term results have shown that synthetic hormones sometimes elicit negative metabolic response. Some women can't tolerate synthetic hormones, often suffering with side effects such as bloating, bleeding, and mood swings. In some patients, synthetic estrogens and progestins contributed to development of breast and uterine cancers. So that's synthetic. Synthetic hormones are not perfect, matched to our body. So synthetic hormones produce abnormal metabolites, then cause side effects. So it might not be the drug itself, it could be the leftover of the drug that we broke it down to, can cause the side effects. A natural hormone is perfect fit for the body and is biologically identical hormone replacement. And since it's been fine for our bodies all our life, once it starts declining, that's preferably what we want to use, something that's been truly helping you, 20 years prior to that. So let's use the same thing. How long should it be on each dosage for how? We'll talk about it in a bit, McKinsey. We're talking about hormones right now. I'm reading out my Q&A. I'll do a little bit of that, and then I'll make more than one video on that. And then we can switch to discussion on GLP-1. So I'll do several of those conversations, and I'll post this onto the YouTube, so then we can come back and watch it there as well. So I'll just finish a couple more points and then we can switch again, okay? Why does my gynecologist prescribe bioidentical hormones, or doesn't? Why does gynecologist does not prescribe bioidentical hormones? So natural supplements such as vitamins and hormones are protected by federal regulation and may not be patented. Major pharmaceutical manufacturers are interested only in drugs that you can patent, because that's what's profitable. They don't profit for things you cannot patent, as we all learned in GLP-1 world. A lot of physicians learn what a lot of physicians, learning is from drug companies who are promoting their products. Therefore, your doctors are primarily taught only about synthetic products. Bioidentical hormones do not come under specific brand names. Your physician must be self-educated and experienced in prescribing and monitoring natural hormones. They probably just don't know a lot about them and how to prescribe them, or where to get them, and how to properly find the right pharmacy that can get you the right bioidentical hormone to be safe. And again, we've seen a lot of the same things happening with GLP-1. Doctors like myself who completely on board with compounding pharmacies, I can vet them, I can look at them, I can find what I feel is safer for the patient. And there are doctors who absolutely not, especially large corporations, large hospitals, large systems. They're like, we're not allowed to do compounding medicine. Why don't you? We're not allowed. Why? Because we're not. They don't tell you why, but they're told by the top, right? Administration. You just don't do that. We're not going to do that. Why? I'm sure there's some pharmaceutical company push to not let them do that. Same thing happens with hormone replacement therapy, the HRT therapy or bioidentical HRT therapy. We want to use bioidentical hormones. They're primarily available through compounded version of the medicine. And to get that, we need to have doctors who are comfortable finding the right pharmacy for you and the right product for you. Compounded pharmacies are the specialized, like smaller pharmacies. They're not huge pharmaceutical companies. And they make that product specifically to the patient a lot of times. In the past, I could call the pharmacy, compounding pharmacy, and say, look, I know you have this ointment that we usually use, let's say nitro paste for the heart, but I want to use this ointment for different purpose. So I need it to be not 4% strength, but 0.4% strength. And compounding pharmacy is the one that will be able to do that for me. Okay? So when doctors want to change something in the medicine, maybe take away certain additive, maybe change the formulation and dosage, I cannot call up Novo Nordisk or Eli Lilly and be like, yo, can you change that for me? Because they can't, right? I can call compounding pharmacy to do it for me. They've been around for a very long time, and doctors been using for very different purposes, for many different reasons in the past. And they're absolutely legal and certified. And of course, we always find the one that we like based on what they do for us, right? Like GLP-1, I want to make sure they got the certificates that are accredited appropriately for my patients. And I do the same thing for HRT. Let's see, what is the truth about the recent publicity about the risks of taking hormone? So again, there was a large study about 20 some years ago. It's called the Women's Health Initiative, or WHI. So you'll hear it mentioned many times in people who talk about hormones. It was one of the largest studies that they conducted, studying estrogen synthetic, specifically Premarin, and progestin, Provera. Remember, progestin is not progesterone. They're different. So there were different arms of the study. So usually when we do clinical trial, we'll get, people to do one medication, separate medication, controlled arm, right? And then we can compare who did better, right? So different drug combination and maybe no drug at all. So then we can compare them. The arm of the study using Premarin and Provera, or Prempro, was discontinued before completion of the study because of increase of risk of breast cancer and heart disease. Those were detected in early stage. The risk is attributed to Provera portion of the regimen. Provera is the progestin part. This is not the first time progestin have been implicated in increasing risks for women. The arm of the study using Premarin did not show an increased risk of breast cancer, but was discontinued because of increased risk of incidence of stroke in older women. The recent study showed the natural estrogen, natural stuff did not cause the same risk. Okay? But once that stuck to those medications, remember synthetic medications, nobody wants to get it unstuck from those medications. And then by trying to generalize, they say, well, those two drugs are bad, therefore every drug in this class is bad, whether it's bioidentical or not. And it's just not true. We know that. Also, the problem with that particular trial was they studied people in the wrong age group. They were studying primarily people 62 to 74 years old, way past menopause, like way past menopause, right? Most people on average will get menopause like 48, 52. And they were studying people 62 to 70 years old. Therefore, they were already probably harboring some of the breast cancer. Thank you. They were already probably having some cardiac conditions like cardiac disease, right? Because you actually need to start your bioidentical hormone therapy within first 10 years of your menopause. You do not want to wait until you were without the hormone for 10 years because the damage is already being done. It's 10 years older for your body. And of course, people who are younger, who get surgical menopause much younger, they need to start therapy pretty much right away. And we can start therapy for perimenopausal symptoms, which is 10 years potentially before menopause. We start having symptoms way before that. I have all of them. I have a lot of them. I got my blood work back, so I'll be evaluating it today to see what I'm going to start myself on. We'll be talking about it. So, but this is going to be our first part video to talk about frequently asked questions about estrogen progesterone replacement, bioidentical hormone therapy. Hopefully it's a good beginning. So I'm going to stop live on YouTube and then switch back up to TikTok. And the TikTok people who requested me to have my videos on YouTube, now you have at least one part going there to talk about this subject. Hope it helps. I have to figure out how to stop it. How do I stop it? I really actually do not know how to stop the recording. How sad is that?